Morning, good afternoon, and good evening to all joining us today. Welcome, distinguished panelists and participants, to this webinar on advancing school mental health at scale. My name is Khairia Hana. I'm a mental health youth advocate from Malaysia, and I am one of the young people serving on the Youth Advisory Board for the Child and Adolescent Mental Health Conference held in Cape Town about a month ago. Today, I have the pleasure of moderating this webinar together with Urmila Saka. And before we begin, I would like to invite everyone to briefly introduce yourselves in the chat. So feel free to share your name and where you're joining from. And before we move to our speakers, I'd like to remind everyone of a few quick housekeeping points. Firstly, this webinar is being recorded, and the session will last approximately 75 minutes. So we kindly ask all presenters to keep closely to their allocated speaking time. I will do my best not to interrupt, but I may need to step in if we are running over time. And for participants, please keep your microphones muted throughout the session. We also warmly encourage you to use the Q&A function to share your questions throughout the session, as we will reserve time for a panel discussion and audience Q&A towards the end of the webinar. So to begin, it is my pleasure to introduce Urmila Saka. In February 2026, Urmila joined UNICEF's global education practice in Amman as global lead on skills and secondary education. Prior to this, she founded and led programs at Generation Unlimited. Urmila brings more than 25 years of experience in international development, spanning education, skills, employment, child protection, gender, and social policy across both development and humanitarian contexts. She will now offer opening reflections and help set the stage for today's discussion. Urmila, the floor is yours.
Well, thanks so much, Karia, and it was great to be with you in Cape Town recently. And just good morning, good afternoon, good evening to all colleagues and friends from around the world. And I'm checking in from Amman, Jordan, and the global education practice of UNICEF. Really, really happy that I could be here with you all and excited to be here for today's webinar on advancing school mental health at scale. I'm delighted to be co-moderating this session with the dynamic and brilliant Kyra Hana, a member of the Bold Ideas for Bright Futures Youth Advisory Board, who made an amazing contribution to the forum. And today's webinar is a part of a follow-up and part of our community of practice contribution to the whole field of mental health and psychosocial support, particularly using schools as a platform to addressing this key issue globally, and a follow-up to the big forum that took place in Cape Town recently from 18 to 20th May. I personally learned a lot, and I had the privilege of attending the forum, and I was truly struck by both the diversity of the presentations, the quality of all the contributions made. Many of you were there. And I was truly struck by how rich and inspiring space we had for learning and exchange. And it really brought together a very interesting mix of practitioners, academics, researchers, policymakers, development partners, and especially the young people. Hearing from the young people, that was a core part, making sure that young people were actually presenting, co-moderating, deciding things with us. And that was the best part, I thought, of the forum, looking at, what are the innovative approaches and practical experiences for advancing this field. As part of the steering committee, UNICEF has been very keen to ensure that evidence, insights, and practical experiences do not remain only with those that are able to attend such conferences, that we want to make sure this knowledge is more widely accessible to you all, to all of our networks and around the world, so that we can create a broader movement to engage in this area. So among the many themes explored during the conference, one of the strong messages was the central role, the pivotal role that schools and education systems play. And it not only in promoting mental health and psychosocial support, but also the well-being, preventing mental health conditions, and facilitating access to support and services for children and young people. So for this reason, we selected presentations that are especially relevant to advancing mental health psychosocial support through schools. And today's webinar is the first in a series focusing on these approaches. So over the next 75 minutes, we will hear from speakers who share these experiences in research, policy, and then in practice. We'll start with a presentation on mental health programming and scale by Tom Osborne. Very happy that he could join us from the Shamri Institute. And then we'll hear about UNICEF's experiences in China. So excited for that as well. And that'll provide practical insights into systems building. Then the agenda will turn to the Youth Manifesto, which was presented with glory during the conference at the end, which is an important reminder that our young people must be at the center of policy and programming discussions in mental health. And then finally, we'll close the webinar with a presentation on a policy lab, followed by a short and engaging panel discussion. So we are truly delighted to have such a rich group of speakers and participants with us today. We hope that this will also help in providing renewed momentum for the field and with education systems worldwide. So with that, I'm going to turn to our first presentation, as you can see from the flow, and it's to introduce firstly Tom Osborne, and he'll deliver a 10-minute presentation, and then we'll have a short Q&A. So he was one of our amazing keynote speakers at the Bold Ideas conference, and his presentation we felt deserved to be shared more widely with our network through this webinar series. He's the founder of Shamri, Africa's largest youth mental health provider, and he's reaching more than 100,000 young people each year. He's a social entrepreneur, researcher, and advocate for youth well-being, and he's led the development and scale-up of evidence-based mental health interventions across Africa. He's also authored more than 50 peer-reviewed publications and continues to work at the intersection of youth mental health, social innovation, and systems change. So really, it will be great to hear more from you, Tom, here in this forum, and it's a pleasure to welcome you to the webinar. So over to you, Tom, please.
Hi, everyone. Can you hear me?
Yes, I can hear you. Thank you.
Great. Really excited to be part of this webinar, and thank you so much for having me. So I'll structure my presentation in two parts. So the first part I'll just briefly just talk a little bit about like some of the design principles that we try to apply at Shamiri with regards to trying to close the treatment. And then the second part, I'll talk a little bit in details about what the Shamiri model is and how it works. Just to be able to ground the presentation a little bit. So I'll just go ahead and share my screen. Okay, great. Can you allow me to share screen? Oh, you're already showing the presentation. Okay, great. Okay, great. Cool. That also works. Great. So basically, the design principle that we've been using at Shamir is really inspired by this idea of scale. And oops, the screen disappeared. Can you see the screen?
Yes, we can see them.
Okay, perfect. Great. Yeah, and so basically, like the idea of the work we're doing at Shamir is inspired by this notion of scale. And the reason why the notion of scale is quite important for us is because the youth mental health treatment gap is pretty large, So about 40 to 60% of young people around the world who want mental health services can't get it. And this ratio gets as high as like 80% in low resource settings, like Kenya, where we work in. And so just with this in mind, when we were starting Shamir, it seemed to us that to really, make a dent into this problem, we had to think about how could we be able to design intervention and intervention models that could do this at scale. Um, the next slide. Great. Get the next slide again. Yeah. So when thinking about scale, there's just a few things that I want us to have in mind. So on the right, if you can just press we have this graph, and it's a graph of impact over time. And so, how you can imagine this is we want to achieve impact with whatever work that we're doing. And in this case, the type of impact that we want to have is that we want to be able to allow everyone who has access to who needs access to mental health to achieve it. And we want to do that over time. And traditionally, when we are thinking about these two things, often we think about it from a linear perspective. So if you're running a program, let's say in year one you serve 1,000 people, and year two you serve 2,000 people, etc. And the linear growth actually sometimes creates the illusion of like progress. But if you are to really extrapolate it, if you're only growing linearly, you will not really be able to close the full treatment gap in time. So at some point, we need to be able to move from a linear curve to a more exponential curve that allows us to be able to get to scale, much more quicker. And so that's kind of what I'm going to talk about. How do we move from this linear curve, and how do we get to an exponential curve that allows us to achieve, impact at scale? Next slide. So, how do we do that? So, to do that, we need to be able to ensure that as we are designing a solution for mental health, we think about making that solution scalable. And to make that solution scalable requires two things. So, the first thing that it requires is that we need to design for impact. And I'll explain this a little bit. So designing for impact, more concretely means that if you're designing an intervention, let's say that, treats depression, it has to actually be able to quote unquote treat depression, because that is the impact that you're trying to do. And most of the time, this is where a lot of the research that we do, falls upon, so we design an intervention and we see if it's actually, impactful. So that's, obviously the first part. But then the second part that we also need to do is we then need to figure out, okay, now that we've built something that works, how can we make sure that we build something that can work at a really large scale? And what that means is how can we make something that is still impactful when other people are running it who are not us? So for example, if you're a researcher and you've designed an intervention for adolescent depression, which is effective, you've done the first part, which is you've designed for impact. And now the next part is how can you make sure that you still have this impact when someone else outside of you, is running it? And more broadly, how to do that requires us to do two things. So the first one is when we are designing for impact. More broadly, we start from having an idea. So for example, you may have an idea that lay provider delivery interventions could work. Next slide, please. Um, yeah. But then you need to then move all the way from that idea into a replicable model, and I'll walk us through this path. And then after you've done that, you will then need to think about who is going to do it and pay for it, and how are we going to make sure that we can sustain the impact as we are scaling. Next slide. So I'll give an example with what we do at Shamiri. So at Shamiri, we have this idea of tiered lay psychotherapy. So basically, the idea is we can expand the workforce of folks who deliver mental health interventions into three tiers. So in the first tier, we can train recent high school graduates as lay providers to lead group sessions. In the second tier, we can work with folks who have some background in mental health, be it a bachelor's in psychology or clinical social work, and we can work with them to to train, supervise the first tier and to offer one-on-one support for folks who need, more than group sessions. And also we could work with a few experts who we have, for referral and complex cases. So that's, the first part, of designing, for impact, which is coming up with an idea. And in our case at Shamiri, that idea is tiered lay psychotherapy. But that idea has to be connected to something, to a mission, to impact. And for us, the mission and impact is treating depression and anxiety. So what we're trying to do is we're trying to use this idea to arrive at a certain outcome, which is treating, depression and anxiety. Next slide. Um, so that is the second part, which is our mission. So we've started with an idea, and with that idea, we want to kind of actualize our mission. And so the next part is how do we put that idea and that mission together? And that is where our theory of change or theory of impact, kind of comes into place. So how does our idea eventually lead to the type of like impact, that we want? And more simply, we can use this framework in the next slide to connect those dots, and if you just want to press next. And so just go back. Yeah, just go back a little bit. Thank you. And so basically, we have our idea and we have the outcome. But for us to be able to actualize that, someone has to do something differently, so we have to change some form of like behavior. So there has to be, a behavior change that happens. And so to give an example of this with our idea and mission at Shamiri, could note the next slide. Uh, if we train, lay providers and supervisors within that tiered care model, they will be able to deliver effective interventions. And the outcome is that, we will be able to then treat depression, anxiety amongst young people. So now we've connected, our initial idea and our mission with, some behavior that we have to change, right? And that's really important because impact only happens if people change their behavior. Next. Um, right. So if nobody acts, nothing happens. So you may have the best idea, you may have the best evidence, but if nobody acts, nothing, really happens. So a crucial step in designing for scale is mapping out who needs to do what for this change that you want to happen. And one of the ways that we try to do that at Shamiri is through this idea of a behavior map. Next slide. And so basically what the behavior map does, it allows us to map out all of the different types of people who need to change their behavior for that, impact or outcome that we hope for to happen. And so in the example of Shamiri, next slide, because we work in schools, so schools have to do something differently. So they have to sign up for us to deliver our models within the school. Teachers have to be mobilized and they also have to, agree to support us. Students have to also sign up and attend the sessions, and they also have to practice whatever they're learning in the sessions. And if they need help, they need to, do something different, which is go to the supervisors or be referred to, like the clinical experts. And so all of these things have to happen for us to get this outcome that we want. So if nothing happens, if any of this thing breaks down, we never really arrive, at that outcome. And so this exercise is really important because it allows you to realize that once you have a great idea or a great intervention that can be impactful, your job actually shifts away from that intervention to basically mapping out who has to do what differently and finding ways of making them do that differently, right? And so we think about that as drivers, so what are the drivers which are going to, make the behavior change, happen, right? And so basically, at this juncture, your role switches from quote unquote designing an intervention to quote unquote thinking about the drivers that you need to make the behavior happen and designing, kind of like around those drivers. And a way of thinking about drivers is by thinking about it from the perspective of like, we do this to make this happen. So this is what we are doing so that we can be able to like make this, behavior change, happen, right? And so, for example, in the example of Shamiri, we have to start recruiting schools. We have to find a way of building trust and mobilizing teachers. Next slide. We have to, find ways of like driving student enrollment, training and supervising providers, doing, kind of like follow up. And so this becomes the set of activities which eventually are replicable and can be taken to scale. It's recruiting, it's this enrollment, it's training, supervision, it's, doing all of this, follow-ups. And so eventually it is this activities within the drivers, that becomes our model. So basically, when we are talking about like the Shimiri model, what we are talking about is just like the set of activities that we need to do, to ensure that people replicate efficiently. Next slide. Right. And so the reason why I'm beginning with this is when we are designing for scale, often we get too caught on the levels of our intervention or our programming. But what we really need to be, thinking about a lot is what are these drivers, what are these like activities that we need to be able to replicate and do efficiently, because it is these activities which are going to drive the behavior change, which is then going to lead, to the outcomes, that we want, right? And you can generalize this into, different buckets. So like this slide gives an example of the type of activities that we have to do, so we have to train providers, we have to, obviously build the protocols for the different therapy, etc. But on a day-to-day, it is this set of activities that we are doing to make, this change happen. And so this is the first part, and it's the easy part. It's basically starting from an idea or an intervention, thinking about what the outcome you want from that intervention to be, and then connecting the dots by understanding the behaviors that need to change and the drivers that you need to do, to change that. And so then the next part is thinking about how can you then move that model to scale next. And to do that, we need to think about two things. We need to think about who
Great,
runs it
just
and who
great
pays for
presentation,
it.
Tom. Just a great
Right.
presentation so far. Just to alert that, just if you could wrap up in 2 minutes would be great. But great presentation so far. Thanks.
Great. Thank you. Yeah, so you need to have a doer, the person who's going to replicate this at scale. And this is almost never going to be you, So you need to think about who is going to be doing this. And then the second part you also need to think about is who is going to be, paying, for this. And it's crucial to do this because this then informs, some of the design decisions that you do at, like the very at the very beginning. And so once you've identified your doer and your payer, which can either be other businesses, NGOs, government, or direct consumers, as you're scaling, you then need to collect evidence on four buckets, which we call like the four enoughs. So the first is the model good enough? So does it still work? Is it big enough? Does it work across all geographies and contexts? Is it simple enough? Whoever your doer is, can they be able to do this and replicate this? And is it also cheap enough? Because eventually someone has to pay for it. And so the journey of scale is iterating on this four enoughs, to make your model, really, really scalable. Yeah, and so that's a pretty high level overview of just like some of the ways that we are designing for impact at Shamiri. And at this point, I will turn it over to any questions.
Thanks so much, Tom. Like really, really insightful. And we learned a lot from the forum in South Africa when we were there in Cape Town about all this amazing work. And I'm glad that everyone can share from your great insights and things. As we're running a little bit short in time, I'm going to pass it over to Kyria, if you could proceed. And then just to say, Tom, maybe later on you could come in as people have questions in the next Q&A segment. But please go ahead.
Yep, totally agree. Thank you, Urmila. So we are now pleased to welcome our colleagues from UNICEF China, who will share their experience and reflections on advancing child and adolescent well-being in China. Our first speaker is Dr. Ali Shirazi, Chief of Health and Nutrition at UNICEF China. Dr. Shirazi leads UNICEF China's efforts to strengthen policies, systems, and services that improve the health and well-being of children and adolescents. We are also joined by Jeffrey Nan Lee, health specialist for maternal, neonatal, child and adolescent health and health team lead at UNICEF China. Jeffrey brings extensive experience in health systems, strengthening and in supporting the institutionalization of child and adolescent health interventions. Our third speaker is Xiaobo Tian, health officer at UNICEF China. Xiaobo works on initiatives to promote child and adolescent well-being through schools, health, and community platforms. We are very grateful to all three colleagues for joining us today and for sharing UNICEF China's experience. I will now hand over to the team to begin their presentation.
Thank you very much. Do you hear me, right?
Yep, we can hear you.
Okay, thank you very much. So thank you very much for that introduction. As you mentioned, my name is Dr. Ali Shirazi. I'm the Chief of the Health and Nutrition in UNICEF China. I will be joined by two of my colleagues in this presentation. I will just go through the issues in the two slides, and then I will give the floor to my colleagues so that they can talk about this particular intervention. Next slide, please. Yeah, so last month, the Lancet report of global burden of disease came out, the most recent one, just last month. And this shows how important it is what we are doing in the health and also in terms of education in the schools for the mental health. This Lancet report showed that 1.17 billion people globally are living with some kind of mental health disorders in 2023, which the last date that they had the data. And many of these cases have been new. And if you look into the data from 1990 to 2023, you will see that the people living with mental health disorders have doubled. Now, this might be partly is because of these people, the number has increased, and partly is because we have better data and better surveillance systems in place, probably. Okay, so you will see 171 million mental health disorders, DALIs, in 2023. And DALI is, if you don't know, is disability adjusted life years, is a way in health to compare between diseases and see how much effect it has on the life of the people. And you can see that DALI of the mental health disorders has also doubled from 1990 to 2023. Right now, mental health issues are the fifth biggest cause of global DALIs in 2023, which is very important for us, up from 12th in 1990. So it shows that how much the mental health issues has increased. And if you look into the breakdown of that, you will see anxiety is first, the most affected people. Most prevalent issue is anxiety. Second is major depression, and then it goes to other areas. Interesting is that DALIs relates peak in adolescent years, means that if you have a mental health disorder from the adolescent year, 15 to 19-year-old, probably during your lifetime, it has the highest impact compared to older people. And the implication of that is that investing early in the prevention, in the support, in the surveillance, in the coordinated policy action, in all of that is important to do it as early as possible in the young age. Now, the program that we devised in China's response had two components, basically. One is the school-based service package. So these are interventions in the schools, 10 modules that talk about different issues And my colleagues will talk more about that, from the from the stress, from how to negotiate, how to do your relationship, have better relationship, how to seek help and all that. So there are 10 sessions that is basically they're based on these 10 modules and 10 sessions. They are administered in the school. And then there is a separate one, which is a peer support toolkit. Studies show that peer-to-peer education, particularly, is very, very important in the adolescent years and in the schools, because children listen more to their own peers. And based on that, we have devised this module, which is look, listen, and link, meaning that the peers who are trained will look for any mental health issues in their other peers, in other classmates, listen to them, but don't intervene. They link them to an adult, to a teacher that has gone through the training, or to others' health systems after that. And the backbone of this is the partnership between health and education, referral between the schools and the health systems, and health system back to the schools. Next slide, please. So very briefly, schools are see the distress early, basically. The challenge is not simply adding more mental health activities in the schools, but basically making it a safe area for children to express themselves and to link them. So you see the model is starts from the school, but links with the health, particularly in the PHC, primary healthcare level, to the family and the caregivers. So it is the parents and all that will be involved in that, and to the youth and the community. And part of that link to the youth is through what I mentioned, the peer support. So the core message is that working with educational system is very important as strategic partners, and the schools will be a very active entry point for integrated support. We are not looking at it only from the health perspective, but more from MHPSS, basically psychosocial support. Thank you very much. My colleagues will continue.
Okay, thank you, Ali. Next slide, please. Yeah, the first component is the school-based service package. It is a universal, low-intensity package delivered by trained teachers or school counselors. And a simple way to say it is, this is not therapy in the classroom. It is structured participatory support that helps adolescents understand emotions, stress, relationships, coping, and help seeking. And the design question was, how can we make it teachable and safe in real schools? So we used existing school actors, simple facilitator manuals, student task sheets, practical classroom activities, and links to referral and supervision. Next slide, please. And the second component is peer support. Adapted from UNICEF's I Support My Friends approach, look, listen, and link. Why we do a peer support? Because adolescents often turn to friends first. Peer supporters can notice distress, offer comfort, and connect friends to trusted adults or services. But the most important word here is boundaries. Peer supporters do not diagnose, counsel, or manage complex risks. Adults remain accountable. For issues such as self-harm, bullying, trauma, or severe distress, clear escalation and referral protocols are essential. So peer support is about empowering help-seeking, not transferring adult responsibility to adolescents. And then Jeffrey will now share what this work has achieved and what others may take away. Over to Jeffrey.
Thank you, Xiaobo. Next slide. Let me focus on the bigger message behind the numbers. As you see, lots of numbers or achievements. It is not only about the students were reached. The achievement is that several building blocks started to come together. First, reach. The program actually covered more than 300 schools and reached nearly 1.45 million adolescents through the school-based services and activities. Second is the capacity. Over 2,000 facilitators and more than 3,700 excellent adolescent peer supporters were trained. Third is the evidence. Our randomized control trial, which has been published in the Lancet journal, involved over 5,000 students, found that reductions in depression and anxiety scores and improvements in the self-awareness, social emotional skills, and mental health literacy. And fourth, the pathway and ownership. There were over 1,000 school health referrals, more than 100 policy documents issued, and the local matching resources matching together with UNICEF our resources. So the real achievements is the combination of delivery, workforce, evidence, referral, and also the local ownership. Next slide. So what other countries can take away from China's experience? I would not start with the question, which curriculum should we use? I would start with a very different question. What support system needs to sit around the curriculum? First, work with the education systems as strategic partner and with schools as active entry points. Schools can reach adolescents early, but they also need support from health, family, and also community services. Second, design for real workforce. In many settings, there are not enough specialists. So teachers, counselors, and also non-specialists need simple tools, training, and also supervision. Third, set safe boundaries. As Xiaobo mentioned, everyone needs to know what schools and peers can do, when to refer and when to escalate. Fourth is to build the referral backbone. School support becomes safer when it is linked with the primary healthcare specialist, specialized care, family and community services. So our final message is this: the bold investment is not only a mental health curriculum, it is the school health workforce, referral backbone, and also the quality system that makes early support safe, equitable, and sustainable. And the next slide. Thank you very much, and we look forward to the discussion.
Thanks so much. Thanks so much. Do we go on to Q&A or I go straight in?
This is now, sorry to jump in, Nurmila. Now it's the time for introducing Denzel.
Yes, that's what I just wanted to check. So, but great presentation. Before I move on, thanks so much from the team, the China country office and the partners. Amazing work. I'm sure there's going to be questions and things in the chat, and if you want to interact over the chat until we get to Q&A a bit later and panel discussion. So now I'm really happy to introduce Denzel Wata, and he is a member of the Youth Advisory Board and a youth advocate from Zimbabwe. His advocacy focuses on mental health and sexual and reproductive health and rights and climate change. And through his work, he champions meaningful youth participation and helps amplify young people's voices in shaping solutions to the issues that affect their lives. So it's my pleasure now to give the floor to Denzel, and he's going to be presenting the Youth Manifesto that I referred to earlier, that was developed by the board and shared during the conference a few weeks ago. Denzel, are you there?
Yes, I am here.
Denzel, yes, please. And if you can turn your camera on, it's great to see you again.
All right. Thank you very much.
Please go ahead.
Okay.
And do you have a camera? Can you turn your camera on? Is it possible?
Yes, it's possible. I'm just waiting for the host to turn it on back for me. Yeah.
Fantastic. Great to see you. Please go ahead.
Yes. Thank you very much for the introduction. It's really good to be fully in a room of people who care about young people's mental health, because that's exactly what drives the work that I do and what has brought me here today. As you heard, I'm from Chituliza, Zimbabwe, and one of the things that has always pushed me is the gap between the issues that young people face and the spaces where decisions about those issues get made. This manifesto was an attempt by us to close that gap. As you heard before, I'm part of the Youth Advisory Board for the Bold Ideas for a Brighter Future conference, which was a group of young people from all corners of the world around, and we were united by one belief that young people's voices should actually shape the systems that are meant to support them. So earlier this year, we set out to listen. We surveyed around 221 young people aged 10 to 35 from over 40 countries. And we asked them some genuinely open questions, how they were doing. What does support look like where you are? And what would be a better future for you? We also drew some insights from UNICEF's poll findings from South Africa and social listening data from Nepal, and research from the past conference as well as the current conference, which were in terms of abstracts. What came back was honest, sometimes painful, and impossible to ignore. So we turned it into something which is our youth manifesto. This was a document that captures what young people are experiencing, what they need, and what they are asking for. Not written about them, but written with them. I'll drop the link to the manifesto at the end of my presentation. So what were some of the key findings that we actually were able to find through this evaluation? The picture that emerged is one that I think many of us will recognize in this room, is that around 86 of the young people we spoke to lived in environments where mental health was minimized, hidden, or not taken seriously. 68% say that they carry the weight of being the reliable one for the people around them. And their friends and everyone is just leaning on them, even when they themselves are not okay. When it came to the schools specifically, which is one of the main reasons why we are here, the findings were actually striking. 74% of the young people we talked to said that few or none of the teachers feel equipped to support their mental health. And 66% said that they've seen no meaningful improvement in school mental health support over the past 2 years. Not because teachers don't care, but because the training, the time, and the systems are often not adequate enough to meet to the needs and the requirements of the young people. Outside of school, the digital world is also adding a new layer of pressure, as 64% of the young people say that they feel overwhelmed by the pressure to constantly be online. 47% say that they leave social media feeling anxious, drained, or lonely. In Nepal, when researchers listened to what young people were actually talking about online, depression was the dominant theme, followed by anxiety, poor self-esteem, and a feeling of socially isolated. And when young people do try to reach out for support, we found that 70% of those that reached out find it difficult to access professional help. In South Africa, 73% of the young people say that they needed mental health support in the past year, but only 38% actually sought it. That gap between the needing help and the getting it, that's where we are trying, that's what we were trying to address and actually close. But here's what genuinely moved some of us when we read through the responses. It was that despite all of that, when we asked the young people what gives them the most hope, the number one answer wasn't money, status, or security. It was making a positive impact on the world. More than careers, more than finances, more than relationship. It actually shows that our generation is not giving up. They are paying attention, they care, and they even want to be part of the solution. One recipient actually wrote that we are not passive recipients, we are leaders now, ready to work alongside you in expertise born of lived experience. That's what the manifesto means to us as young people. It's not a list of complaints, it is an invitation. So what do we do with that invitation? The manifesto actually outlines 5 different areas for action, and I just want to bring close attention to some of them, because everyone in this room touches young people's lives differently, and there's a role for each and every one of them. So in the manifesto, we address that if someone is a teacher or a school leader, The manifesto was calling for every school to have trained mental health professional, not as a luxury, but as a baseline, because we found that young people spend most of their time in school, and around 74 of the young people we researched said that they feel unseen there and when it comes to mental health. So we're not saying that we need them to be therapists, but we just need them to be curious, present, and willing to advocate for proper support in schools to make a real difference. And to the policymakers, the system leaders, the people who have influence and whose decisions affect the young people, the manifesto was actually saying we need these people to invest in long-term community-led mental health system, something that is grounded and rooted in the community, led by the young people, and especially in lower resource settings, to collect proper data, broken down age by age, gender, geography, and disability, so that these gaps are visible and accountable is actually real. To the researchers, the program designers, we actually say that we wanted a sort of co-designing with the young people, not for them, but with them, to bring the youth from being just consultees to actually have them actually consult, because we actually found that if we have young people on the table, if we have young people being part of this research processes, it actually helps enrich and address some of the issues that the young people actually need to be addressed. And to the young people themselves, we found that 69% of the young people that were surveyed say that they are already ready to advocate for mental health. And we wanted to normalize the conversation, and we urged the young people that were reading the manifesto, and I'm again just urging the young people who are also in this room to normalize the conversation within your school, support your peer, claim your seat at every table that makes decision, because the thread is running through all 5 of this, and each and every one is not a standalone peer, but it's actually connected one and one about. One thing that really stood out throughout the whole process was nothing about the youth without the youth. So whatever the role was, we were asking to bring young people in, not as an afterthought, not checkbox, but as co-creators. So I'd encourage each and every one of you to go through the manifesto link, which I'm just going to share briefly inside the chat. And yeah, that would be my presentation. Thank you very much for
Thank you
invitation.
so much. Thank you so much, Denzel. I've already went ahead and shared the link for you, and everyone feel free to have a look at it. So it is now my pleasure to introduce our final speaker. And after a presentation, we will move into a brief panel discussion with all 3 speakers. Our final speaker, Madison O'Grady Lee, is manager and co-founder of the Origin Global Youth Mental Health Fellowship, an online education and mentoring program for youth advocates around the world, and she is a practicing psychologist with more than a decade of experience in youth mental health advocacy. Madison is committed to strengthening youth leadership and participation in mental health systems. She completed her PhD at the University of New South Wales, where her research focused on culturally appropriate approaches to understanding and assessing mental health in First Nation communities. Without further ado, the floor is yours, Madison.
I'll get started while my camera turns on. Thanks everyone for your presentations. It's wonderful to get to be a part of today's webinar. And so I'm going to be talking through a recent project that we've been running called Policy Labs, where we ran our first global policy lab in Malaysia last year. So if I can go to the next slide, please. So I'm joining you from Origin Global, and Origin Global is committed to supporting countries and communities around the world to implement programs that are culturally grounded and meet the needs of young people. At Origin, we're really passionate about ensuring that young people are engaged in meaningful ways, especially young people with lived experience. As we heard, so beautifully from Denzel, like nothing about us. Young people need to be consulted for us to create solutions that are actually going to work and be used for young people. And so we run programs mainly with young people in equipping them in mental health advocacy skills. And throughout the years of doing this work and seeing more and more young people come through the ranks, running incredible programs, we noticed there was quite a big gap often with policymakers, where the policies, system levels were not meeting the needs or the demands that young people had. And so this is where the concept of policy labs internationally came for us, to complement the work that we were doing with young people from a bottom-up approach to start having a top-down approach. If I can get the next slide, please. So a policy lab is a workshop that really aims to bridge the gap between research and practice and experience. It was developed by King's College London, and what it is, I suppose what really makes it different is that it's about bringing all of the stakeholders together. Often we consult young people separately, or we consult policymakers separately. The, I think, beauty of this model is that it actually brings together all of the key stakeholders to have these discussions, where we can understand from young people's perspectives what they want to see. We can understand from policymakers' perspectives what's actually feasible or going to happen, on the ground, and how can we find a way to work in that middle ground that is meeting the needs of everybody. A solution that is going to work, that young people want, but also a solution that is feasible and going to work within a system. Next slide, please. So during the policy lab, we bring together all of those stakeholders. So it's about a group of 25 to 30. And we start off with running a lot of different activities, but really looking at where has success been achieved within a country, where are the opportunities for improvement? And then we look at the development side. So where are the opportunities? What have been barriers in current policy? What are the enablers that have worked for policies that are happening or would be good policy solutions? To then start to identify how can we improve current landscapes, but also where are the opportunities to add in new policies or new system levels of change? So if I can get the next slide, please. And so to start a policy lab, there's months of work that kind of go into this, and we work with a local organisation or a young person to co-facilitate the lab. They then kind of provide that cultural context and bridge, whereas we bring the expertise of the model. We don't pretend to be experts in the content, nor do we ever want to be, but rather we want to work collaboratively with the communities that we're working with. And so to start with the policy lab, we identify the stakeholders who are relevant to come, and we also look at the current policy landscape and where opportunities might be. This briefing pack that we develop from all of this information from our meetings, from our research, goes to participants to kind of form the day and to get everybody situated in what we'll be looking at. It also helps us to address the policy question, so where we actually want to focus on. And so as we were doing this work for Malaysia, these were kind of the key documents and key policies that we found that were relevant to the work. And so there was a Malaysian Youth Mental Health Index, and they had a lot of recommendations, but particularly wanted to see work within policy, community interventions, and in education settings, which is why we are all here today. They also have a national strategic plan for mental health, which we ran this lab in August 2025. So it was up for renewal at the time. So it provided a really great policy window for us to look at how can we strengthen and improve on that policy and improve the next plan that would be coming through the lenses of those who created it, as well as young people who weren't involved in the discussions around this. Can I get the next slide, please? And so for us, it was really easy when we were working with our local organisations and the Ministry of Health that the best opportunity, that our question should be, what are the best opportunities for improving youth mental health that can be reasonably implemented in 2 to 3 years? And also what is required for implementation? Next slide, please. So here, it's a little bit small, but here's some photos of the day of what we got everybody doing. But we really just looked at what had worked, what wasn't working, and what was missing. And then we got everybody to vote as a group collaboratively. Independently. They got to vote as individuals to see what they would like to see discussed. And then using a bit of dot democracy, as you can see to the right there, we then broke everyone into groups to discuss the policy solutions that were selected by the group as the most kind of popular. And then everybody really got to look at that policy opportunity in depth and understand what could be some good implementation opportunities, what could be barriers, and how they would like to see it implemented. And so you can see here on this table, we've got someone from the Ministry of Health. We've got a young person whose face is unfortunately not in the picture there. We've got someone from the WHO. We've got somebody from the Ministry of Youth, Culture and Sports. So a really diverse range of perspectives discussing a common kind of issue. Next slide. And so from completing this work, we came up with 3 key recommendations from the lab, which was to increase collaboration to maximise the co-development of youth-focused services, to incorporate peer support roles in mental health services, and to involve young people with a lived experience in promoting resources and services. So what was really interesting within this lab is that actually across all levels of stakeholders, there was this common interest and common value that actually young people needed to be involved, especially if we wanted services to be used. And government saw young people as key drivers of this change. And now young people see themselves as key drivers of this change. We all see young people as key drivers of this change. But sometimes I think that is missed or not communicated at times. So young people feel like they're really having to fight to have their voice heard, when in reality, in this situation, the government actually really wanted young people's voices at the forefront. And this is a really nice opportunity to see that come to fruition and see how we can actually work together to make sure that this is happening. There was also a really big focus on using young people's lived experience and peer support roles to provide clinical support and low-intensity models of intervention to improve youth mental health outcomes, as well as to destigmatise mental health conditions and help seeking. So if I can go to the next slide, please. And so I can send through in the chat a link to the lab report and its findings. But we really got to kind of, with the group, look at the proposals, the rationales, instruments and outcomes that we wanted to see. And I think it is really nice to be in a space like this where we all agree that collaboration between, all levels of stakeholders is key, especially when we're thinking about the roles that education systems play with young people, that safe third spaces play for young people, and how we can all work together to really improve youth mental health outcomes and advocate for those changes that we wish to see. I'll pop the link to the report in the chat, which has the further details there, but I'll end my presentation there, and thank you all so much for your time.
Maria, I think it's your turn to come in. I come in after for China. But thanks so much, Madison. Great presentation.
Thank you so much, Madison. So we will now proceed with the Q&A session. My question is from the chat. We'll combine some of the questions there, but this is for UNICEF China. Was it difficult to gain schools for the program? And how did you measure mental health indicators like depression, and how was impact in schools monitored? Can someone from the team take this question?
Jeffrey, you want to take this, please? Or Giorgio?
Yes. Thank you for the question. Yes, engaging schools are not always easy, and the schools are very busy, and mental health is a very sensitive topic for education sector. And what actually helped us was working through trusted government and education health coordination mechanisms, also treating schools as active partners, keeping the package practical for teachers and also counselors, and making referral and safeguarding responsibilities clear. And for the measurement, research is one big important component for our program. Mental health outcomes such as depression, anxiety were mainly measured through structured surveys using validated skills. and also administered at baseline and also follow up rather than through clinical diagnosis for every student. And for our randomized control trial, researchers looked at changes in symptom scores and compared intervention and control schools. For program management, we also combine this with routine implementation data such as school participation, trained facilitator, also peer supporters and referrals. We have also published this paper on the Lancet. I will put the link below this question, and if you are interested in reading it, and you can get it online. And thank you for the question.
Thank you so much, Jeffrey.
I-
I'll pass it to Andy.
May I add something to that? Just add to that what Jeffrey mentioned about the measurements. And, one of the most reputable publications that you can get is Lancet. And the gold standard here is RCTs, which is randomized controlled trial. So when you do a randomized control trial, basically in the same situation, you are comparing two different areas. And these RCTs showed that the level of both anxiety and major depression went down in the students. And if you refer to the first slide that I presented, those are the highest areas in terms of disability adjusted life years and GBD, global burden of disease from the health perspective. Thank you.
Thank you so
Great,
much.
thanks so much. And it was really great to have those additional reflections from the whole team in China, and really interesting work there. So I had a question actually for our other two speakers, Tom. Sorry, we have if all three could come in, if they're still online. For Tom, Denzel, and Madison. And it's a question for you all to reflect on briefly, if you could, in 1 minute per person. Looking ahead, what is one bold action or investment that you think governments, donors, and partners should prioritize over the next 5 years to accelerate access to quality mental health and psychosocial support for all learners through schools? What would you, there's many things that can be done, but in your mind, what do you think is the biggest priority for investment? So who would like to come in first? Madison, I see you right on my screen. Do you want to come in?
Yeah, definitely. Thanks, Mila. It's a great question, and I think, a really big one. I think for me, what I see as a really bold way to improve mental health outcomes is actually investing more in young people. So we see that young people are creating so much great change, are driving a lot of change in their communities, yet there still often isn't a lot of recognition of the impact that young people are having on a policy or government level. Also, there isn't a lot of support at times for young people when it looks at more of that kind of funder or government level. So there's a lot of amazing community around young advocates, which I feel so grateful to be a part of. But I think sometimes that is missing within government. So I think having government support those, as well as funders support young people to implement their changes through funding, but also through practical support. No one trains you in how to be a youth mental health advocate. It's not something you can go to university for. We do it because we have a passion and a lived experience. So I think investing in young people and supporting them with that training, with funding to do this work, but also supporting the monitoring and evaluation of that, and seeing how we can continually improve these ideas and how we can bring perspectives together, because I think working in silos doesn't work. We need to work as a community as a whole and really share our kind of knowledge and our perspectives together. So I think that would be my bold kind of way forward.
Great answer. Prioritizing meaningful youth engagement. And I'm sure that lots of people will agree with you. I see Tom next on my screen. Do you have something you'd like to contribute here?
No, thank you so much. So my contribution is, I think when it comes to implementing a lot of this, like interventions and policy, in my 2 cents, and just given the experience that we're having in Kenya, it has to be done through government adjacent agencies. So most of the time that we're working with government, it's more from like a policy, perspective, but less from like an implementation capacity perspective. So what I think an investment which may be catalytic is how can we train and mostly local governments, who are running, local hospitals, local schools, local care systems to be able to have the capacity within the government systems to offer care effectively.
Yeah, great. Another really great point around if we're actually looking from the policy, the high level research, the actual implementation on the ground, it's that whole middle level that we sometimes forget that it's critical to getting policies into practice. A really great answer too, as well, Tom. And then I think we have Denzel. So what would be your great bold investment, bold idea in the spirit of the forum?
Thank you very much. My big bold idea would be accountability, because we see that we've got governments and all of these practices, they're just, we commit to this, we commit to this, we commit to this, but there are not really enough clear mechanisms for accountability to say, if we fail to do this, then what? So my big idea would be we need a lot of accountability in addition to the promises and the commitments that are made to young people's mental health.
Yeah, thanks so much, Denzel. And I would add like accountability and measurement, and how are we defining success? So I think all really great answers. If you put all that together, it's amazing when from looking at especially meaningful youth engagement, looking at that actual implementation on the ground, and accountability and measurement of success. So I think all really great insights from the panelists, and thanks once again. Really, really insightful contributions. I'm sure that everyone benefited on the call. I was sorry we didn't get time. There were some really, there were comments and questions in the chat, but we've kind of run out of time. But just to say that we'll come back, we tried to answer as best as we can in the chat and also in the follow-up, because this is just a continued discussion in person, virtually, such as this. And thanks so much again to all the presenters. So just as I move into the closing and as of our webinar today, not the end of this discussion, because I know we have another one planned next month, I'd like to again thank all, not only the presenters, of course, but also all the participants who joined us from different parts and countries around the world, and all of those behind organizing this. I've had the pleasure to meet the Youth Advisory Board. I know Patricia is online. So all the hard work and all the number of colleagues that have been involved in this, not only in education, but across the organization and our partnership base. So we focused today, the subject today was more on policy design and scale. And we close with, I'd like to close just with a few kind of key messages that I think have emerged from the discussion today. Is that we want to, and it's come up in different ways in your interventions, that we see this as a whole of school strength-based approach. So it's encompassing a range of activities implemented within schools, also in non-formal learning spaces, to improve the emotional, behavioral, and psychosocial well-being of learners, educators, and our broader school community, including teachers and leadership. And these programs are not only about responding to distress, they're also about promoting mental well-being for all learners, providing early support for those who may be at risk or experiencing some difficulties, and ensuring access to more specialized support when needed and services. I think one of the strongest messages today that I'd like to leave you with is that design matters from the very beginning. We saw that in all the presentations, including from China, when you're looking at systems for scale. And if we want to advance this, we need to think carefully from the very, very beginning, how interventions are designed and how this can fit within the ecosystem of education, because that's where you find scale and the sustainability, and that's where the accountability and measurement are really important. This means moving beyond isolated or standalone activities, but thinking about school mental health as part of a broader system strengthening effort. I think a second message that I think we've heard today through the presentations and the Q&A is that this must remain at the center of how we design and implement school-based MHPSS. This means that they genuinely fit for purpose, they're grounded in the realities of children and young people's lives, responding to their problems, needs, strengths, and designing a support that's meaningful in practical ways. So it reminded us that it's rarely about one single intervention, but a combination of different policy services practices at all levels that create this supportive ecosystem. And it also means investing in schools, in capacities of educators, and delivered in ways that are sustainable, and not just at a very high level, at a national level, but as we were discussing, that middle level to the ground level, the village level, the district level, maybe depending on which country you're in, at all the levels. I think very importantly throughout this webinar and from the forum and in this, we really prioritized the importance of young people themselves with the Youth Manifesto. And it's just not only about hearing from young people, but really actively listening to their concerns and really meaningfully engaging young people in ensuring that, there's so many ways that we can engage with young people, not only in terms of ensuring services are reached, they actually access the services, but also their ideas on how the services should be developed, how they can be improved. I mean, young people, and as we know from the young people on this call, that you will have the kind of the best ideas and creative solutions and innovative solutions to take us forward. So if we want these initiatives to be impactful, they need to be part of the conversation, but really integral to the program design and as partners in the space, not just as what we typically call in the development community beneficiaries, but more as partners with young people front and center of everything we do. And of course, we must not forget that in the well-being of adults who work closely with children and adolescents, and often these caregivers and service providers, organizations are forgotten, but they're very, very important. Teachers, counselors, other frontline education personnel, community-based organizations, they're all part of building a safe, supportive, and resilient learning environment. So before we close out, I'd also like to remind you, and I think I mentioned and alluded to this earlier, that this is the first webinar in our two-part series. We're, again, very happy to have you join us again in 2 weeks' time, and there we'll focus on school-based interventions as part of the broader system response, but a particular attention to how arts, sports, and play can leverage children's mental health and psychosocial well-being in schools, and some really, really interesting work, even in the region that I sit in the Middle East. And so you'll hear more about that in the next webinar. So finally, just to once again, thank you, all of you, for being with us today. It's been a real pleasure to host this conversation. In the coming weeks, you'll receive the recording of the webinar, the slides shared by the different presenters, like a really very important resource and tools for us in the space, and a short summary today of the key messages. So again, thanking you so much, and wherever you are, so it could be morning, it's afternoon here in Amman, and probably evening, also for my co-moderator, it would be evening for you, Karaya. So anyway, great to co-moderate with you and to be with all of you today. So with that, thanks so much. And bye for now. Thank you so much.
Thank you, everyone.
Bye. Bye, Prime.
Thank you. Bye.
Thank you. Bye-bye, everyone.
Thank you. Bye-bye.
Thanks. Bye.
Thank you. Bye.
Sorry, Karia.
No worries. Okay.
All good. Thank you very much, all.
Thank you so much, Patricia.
Bye-bye for now.